first thing I want you to do as we're getting started here is that I don't want you to panic. I don't want you to panic on the whole part of understanding what marketing is all about. Folks, marketing is everything that we do in life, whether it is what we're doing here with trying to acquire clients for you, for your medical billing business, whether you're just trying to develop friendships, whether you're trying to sell maybe what you're currently selling right now, or doing things within your community. We're going to teach you, probably learn, kind of hone some of the skills that you already know about, maybe already utilizing, in helping you be able to kind of convert from whatever you're doing right now into doctor acquisitions. So don't hit that panic button yet. Okay. And what I mean by that is that whenever you're going into this, I know that a lot of you have already said to some of your sales reps, or because it's been said in the past, gosh, I'm just not a salesperson. Well, I'm kind of glad that you're not a salesperson, because the last thing I want you to do is to try to sell this business. Because first of all, whenever it comes to doctors, doctors don't want to be sold to anything. They really want the opportunity to you kind of come alongside them and help them discover what some of their big needs are. I can already tell you, as you've already heard from Dr. Rackner, there are doctors out there who are already hurting whenever it comes to their billing and for their revenue and what the shortage of revenue that they're actually getting right now. Now, as we get started here, I want you to be thinking about, when do I really want to get started in this whole business? Now, we are right now just a few days from being in the first part or the middle part of October. So if I am in your shoes here, I'm thinking, gosh, when do I want to start doing some of my marketing? Because I would really like to get started the first quarter of 2025. I'm going to tell you, now's probably the best time. Because number one, we can get you trained, and you can take the rest of this year to start developing all the other things that you got to have to do, plus go through our training. And then through that, you're going to start to develop your potential clients already. So one of the things that we're going to go through today, I'm going to make this very easy for you. Now, in our training, we're going to go through so many other different aspects of marketing. What I've kind of done, I've taken all of our marketing material and kind of condensed it down into what I call the 4 ways to effectively market for client acquisition. Okay. So you're going to hear a lot of different things in each of these 4 categories that are going to be taught during your training class. Like I said, I've just kind of brought it into something that you can kind of take away today and go, okay, I get these big buckets of things that I'll be doing here. Krishnan has asked some questions here. Let me see if when it comes to training, does it cost for multiple persons trainings like spouse in my case? You know what? You can get with your sales rep on that. So I think there may be a little additional cost there, but you can get with them and they'll be able to help answer that for you. Another question, what if doctors are not willing to switch to iClaim system? Can we leverage iClaim for claims through manual inputs, leveraging doctors' existing system? Yes, and I'm going to try to kind of help coach that along even while we go through today there. But that's a couple of great questions. Matter of fact, I'm going to leave your question up there, so it's kind of remind me. I want to actually get back to that a little bit later as we go through the presentations. Okay, and then Ranjit, you're asking, is it possible for medical billing RCM business in India? Yes, you can do this outside the country. However, you got to remember that the clients that you need to get are going to obviously be U.S. doctor-based clients, because we're using the Center of Medicare and Medicaid Services for all the codes there. So as long as you're able to get clients here, you might want to partner with somebody here in the United States, but yes, you can do that. All right. All right, so I got through a couple of the questions. I'm glad that those have come in. First of all, let's tackle the first one here, and that is what I call content marketing. So with our content marketing package, and you're going to see some of the package here in just a moment, you can launch your medical billing business as an authority in the revenue cycle management. Now you see here, I'm not just using medical billing, I'm actually utilizing the word that doctors are going to recognize. That's revenue cycle management. And actually, that's what you need to start thinking about. You can see here, I want you to be able to track, your potential clients and then nurture those leads through well-written professional content. So we've done, if you think about it, actually done all the heavy lifting whenever it comes down to content marketing. Now, this is going to include all of the written material, all of the slide decks that you might want to be able to show to some doctors. So I'm going to kind of go through a little bit of this and kind of let you see and kind of peel back the curtain here so you can see what I mean about content marketing. Now, the marketing material that we're looking at here, these are all 8.5 by 11 flyers, okay? Each one of them have already been written. So you can see that there's copy on every one of these. Every one of these have not only gone through the editing that needs to go through, but it's actually gone through, we utilized a very professional group of folks here to make sure that the wording is proper for you already. Now, one of the great things about all of this content marketing, all the flyers that we're talking about here, is that number one, there's a consistency of look. Okay, so it's not kind of hodgepodge together, and it's nothing that you're going to have to print out on your inkjet printer or a LaserJet printer. This is actually going to come to you professionally printed from our printing company that we currently have been using, gosh, more than 10 years now. And what's going to be great about, there's going to be some sections. You can see there's a little wiggle room towards the bottom of all of these flyers here to move a few things around to put your content on there. This is going to be your name, your contact information, your website, and including your logo. So that's going to go in some of these strategic places throughout here. I'm going to share a little bit about what this content looks like, because a lot of you may be a little concerned about one of those areas of maybe not a lot of knowledge about, and that's going to be coding, because a lot of doctors or a lot of folks that are getting into this always want to know, well, what do I do about coding? Well, we've got that taken care of, because we've got services that are going to go right along with you that are going to help you tell the doctors if they ask you, hey, can you help me with my coding? First answer that you're going to surely be able to share with that doctor is yes. And you can see a little bit here. Now, if you'd like to see this a little bit bigger content, you can request from your sales rep here a PDF of today's slide deck. And obviously, you can look at it a little bit more intently if you want to. But what we're able to do is, again, get you content marketing material already ready for you to use. So as soon as you become part of American Business Systems, you're actually going to get 2 to 3 boxes of material from us. What you're going to have also is a sampling of all of the content marketing material that you can see here. You're going to get all of these, but then your balance is actually going to, again, come from the printer that's going to have all of your logo. And so you're going to want to make sure, that's why I'm telling you earlier on, you might want to start thinking about, gosh, I might want to get started here at the end of this year, because I want to kind of get all of this out of the way so I can get this going and get these to the doctors already. The other couple of other not slides, but the flyers here that we're looking at here, this one also has to do with coding. Now, but it's coding on kind of, I look at on the back side of it. These are claims that have already been processed. So one of the things that you may or may not know is that every doctor, sometime or another throughout the year, it could happen once, could happen twice, 3 or 4 times in a year, that they could actually be audited by United Healthcare, Aetna, Cigna, any of the insurance companies that they're doing business with, or the big one is Medicare. And what those companies are looking for, including the government, they're looking to see if the doctors are overcoding or what's known as undercoding. Because what the insurance companies want the doctors to do is make sure that their documentation matches the actual code that they're utilizing to get reimbursed. Okay, and that's called the procedure code. So they're looking at the notes and going, does the doctor really want to get? Should we pay the doctor $175 versus $125? Some doctors just put all that out there, and then we don't know really what the codes are matching up with the documentation. So what AuditGuard can do, and this is one of the important parts of why I'm sharing this, because you could actually utilize this in part of your marketing to your doctors between now and the end of the year. Even before you start doing the billing, we could help you align some of your doctors to go through an audit, not from the insurance companies, but through our coding group, certified professional coders, go through that, and we can tell the doctor, you know what, you might need to adjust this one code here, but all these other codes that you've been using, doctor, you've been leaving money on the table. So even without doing their billing, you could actually help them increase their revenue between now and the end of the year. Now, what doctor wouldn't want to use you after that, whenever you've already helped them gain money without even doing their billing? And so these services that I'm sharing with you are important for you, but we're substantiating it with the content. So again, you're going to have everything that you're going to need. Now, another service that I like to utilize, especially in my marketing towards the end of the year, because I know doctors are having to deal with this now and looking into 2025, and that's the HIPAA part of their business. So it's all having to do with compliancy, privacy, new rules are changing. They're going to have to take their staff all the way through a new certification going into next year. Why not get the doctor started on this early? This is another service that could be helping the doctor not just generate more money, but actually saving the doctors in the event that something were to happen. Because let me share with you, every year, every doctor and even dentist offices need to go through some type of compliancy training. Every staff member, they've got to have a compliancy officer, and they need to have the documentation already processed, and it takes them a few months to go through that. So this, folks, could take you the next 2 to 3 to 4 or 5 months and really establish your relationship with the doctor. But again, this is all part of the content, what I call content marketing. And then the last one is, certainly as we're starting to get into the end of the year and going into the next year, what about all the claims that the doctor has sent out to patients and they've never gotten reimbursed? Are they just going to wipe all of that out? How about we help them collect that money? Again, this is all pre you doing medical billing. So you can see that I kind of pulled out a couple of these different ones that we're looking at here, and I wanted to kind of highlight a few of those, certainly because, number one, I wanted you to see the quality of the marketing material, but then the specificity of that marketing material. Now, as we kind of keep going through this, the other thing that you're not going to have to worry about content or anything else, and that's your website. I think probably so many people are ready to get in business and they know they need to have a website. But again, what do I say on that website? Again, we already have this professionally written for you. So all of this is ready for you to go the day that you get started with us. Now, you can see I've blown up one of the templates here that you can see, but you can see there's 4 more out there, and there's actually 6, I think there's 12 to 13 of them out there, different templates. But you can kind of see through this and go right into it. You can see we already got iClaim, EMRX, Quick Collect right there on that. Why choose? You see why choose ABC Solutions. That could be your company name, whatever it is, whatever. Welcome to ABC Solutions. It could be, Revenue Cycle Billing Tree Solutions. Whatever you call your company name, that's what's going to go there with your logo. We're going to brand it, everything for you, as you can see here. So remember, content. I'm going to go back up over here to my first little page up over here. With our content marketing package, you are ready to go. We've got you covered with all of your marketing material. We've got you covered with your website. We're also going to show you on through the support how to convert some of that information to go on your all of your social media platforms that you're going to want to put on your Facebook page, your LinkedIn page, all the other social media pages that you're going to want to be out there. All the content is ready for you to go. This is not anything you're going to have to think over time to get through this. The last thing I want to share with you about content is the book called The New Thriving Medical Practice. I can't say enough about this because this is the biggest content marketing material that we have. This is a book that, again, was written by Patrick Phillips and Dr. Vicki Rachner. But the part that I want to share with you that some of you already may know about this is that you are the writer of the foreword to the book. Now, this is going to give you a lot of credibility because it's already with somebody who, from a professional standpoint with Patrick Phillips and from a clinical standpoint, Dr. Rachner. Now, you are the one that's writing the foreword to the book. endorsing the book, and then getting this book to the doctors. Now, you need to know what's in this book. So for those that are on today on this webinar, I want you to be able to go back to your sales rep and ask them for a PDF of this. It's basically a free ebook for you, because I want you to walk away today with something. I want you to be educated. I want you to know what the content of what all of this is about. So that's what you're going to be needing to know whenever it comes down to content marketing. Now, let me see if there are any particular questions. Someone's asking, Tiger's asking, flyers do not produce any results. This is very antiquated marketing, just being honest. Okay, Tiger, so I'd like to hear a little bit more about what you're meaning there, because we're not just utilizing this just to get this is, as I don't know if you heard me in the very beginning, I'm sharing the whole package here. We know that just throwing out flyers is not going to be the game changer of getting a client. But I'd like to hear a little bit more about what you're thinking here, because there is much more, as you can already see here with all of our other content that we have here, plus the other things I'm going to go through here on the four parts of the effective way of accessing and gaining clients. Because I can tell you that these things are working. We've got new folks that have already joined us that are already utilizing all of this, and not just one of these, but all of this together. Because obviously the doctors are going to need to know that. I think what it does here, it positions you as being the expert. It's not anything there that I would say that this is the thing that's going to get you your first client. It's a piece of it. So is Quick Collect same as billing, or is it different? Christian says it is it's different than billing. Quick Collect is a way in which we can demonstrate to the doctor that whenever, instead of sending a patient like to collections, we can actually put a patient on a patient payment plan, so to say, a little bit better, in which that we can help those patients actually be able to pay the doctor back on those things. Let's see what else we got. Let's move on, because for time's sake, let me move on to the next section here of what I want to get to, and that is education marketing. We know that as entrepreneurs, using education marketing strategies, we're going to help you provide webinars and workshops on the best RCM best practices and new regulations. So what we already have here, I'm going to kind of let you see here you're going to have access to this through what's called American Business Systems licensee support site. Okay. Now, in some previous times, we've had the opportunity for me to go in and share this information to you in real time. The ABS LSS website is password protected, so you're going to get access to this once you become an American Business System business owner here. But what I wanted to kind of show you here is that we've got specific written material and webinars that I've used in the past to get my first clients, and that is through educational events. Now, these educational events can be in any format that you want to. I actually did a lot of webinars for my potential clients, and I'll tell you how I went about doing that. I don't mind driving around and going to doctors' offices. Never had a problem about being too shy about walking to a doctor's office, but this is what I did. And to kind of relate this back to what Tiger was asking here, I would take this particular flyer right here, the Compliancy Guard flyer, along with my card, and then ask the front office here. I'd say, hi, my name is Eric, and I'm with whatever my company name was at that time, and I'd like to speak with your compliancy officer. Now, I'm going to tell you that actually got me an immediate meeting with somebody while I was there at that very moment. What I would do, I'd not only have my compliancy flyer here, is what I have here, along with my business card, but I also had an invitation to a website that I was going to do 2 or 3 weeks later from that particular visit. And this was my spiel. I would say, hi, my name's Eric, and I'm with whatever building company that I was with. I'm here to see your compliance officer. And I'd say, hey, listen, I know that you're about to probably coming up on all of your HIPAA training. I'm going to be actually doing a free webinar for you with new resources that are coming up in whatever year I was doing that. Like a few years ago, I was doing it for 2020, 2021, 2022. I'd be doing the same thing as moving forward into 2025. I'd say, hey, I'm going to be hosting a free webinar to go over more new resources as it pertains to HIPAA compliancy. I'm telling you, I would have anywhere from 10 to 15 to as many as 30 people on those webinars. That got me in the door, because what it did, it started to build trust within my community and with the people that I was targeting for my particular business. So as you can see here, I'm going to click this back over here so you can see a little bit again. We already have slide decks already ready to go. There's one on quality payment programs, why doctors should outsource their billing, audit licensing presentation. That's that auditing part of it. The iClaim in-depth overview, the electronic medical records overview, credentialing basics. Listen, doctors are always wanting to know whatever else they can do for their credentialing and how to get money faster. Now, again, the one that you can't see down there is also on HIPAA compliancy. So we have all of that ready for you to go on what we call education marketing. So you combine that with your content marketing. Now with your education marketing, we're going to finally get over to the third arm of this, and that is network marketing. So entrepreneurs, we feel, demonstrate and differentiate themselves by introducing new and unique solutions to the market. Now, this is going to be done, I think some of the best ways that to be able to do this is the most less expensive way to be able to do that is with your local chamber of commerce, the part that you see right over here on the right-hand side. Probably within your area, within driving distance, you're going to find 1 or 2 or 3 different chamber of commerces. Now, the reason I share that, because what I love about this is because there are other people there that want to that are probably already or engaged with doctors already. And I'll tell you who they're going to be. You're going to go to a chamber of commerce, and you're already going to find folks that are not necessarily in billing, but they're already involved with the hospital in some way, with other doctors' offices in some way. You're going to meet a lot of people that are with skilled nursing facilities, long-term facilities. You're also going to find folks that are in home health agencies. You're going to find a pocket full of what I call healthcare professionals within your organization, within your community already, and they're already engaged with doctors. And many of these chamber of commerces allow you to put up some information either at a luncheon that they do. Sometimes they might even give you 5 to 10 minutes to speak. Folks, these are the best ways in which you can, what I call, network market within your own community. I tell you, some of the best, most or a lot of our first-time business owners have gotten their first clients of just attending a BNI meeting. Now, we already have how to position yourself at a BNI meeting or at like a chamber of commerce. We've already got all that set up. Matter of fact, through your training, you're going to learn every aspect of how to be able to do this. So you can see it's not just one way in which we're going to teach you. We're even today, we're showing you multiple ways that you have to collectively be able to get your name out, because the last thing I'm going to tell you about is probably the most important here. So as you're doing your network marketing, there's a couple of other ways in which you can do network marketing yourself. You may be maybe not the best speaker out there, and we understand that. So what we're going to show you and how to build is how to use other sales reps that are, again, already marketing or have already marketed to doctors. And the last one that you can utilize is your own personal sphere of influence. Folks, there's nothing better than folks that you already know to let them know what you're about to engage in doing. And so as we kind of get ready to wrap up this last part and this last piece of the puzzle about what I would say today here is you've got to know the folks that you already have trust with that you can actually go to, and then you're going to be able to share with them. And we've already got those scripts written, and we've got material for you to be able to share with those folks. You're going to be able to completely communicate what you're doing and why you're doing that, which again leads me up to the last thing. So again, before I get to this last thing here, I want to just make sure that we understand is that I've shared with you 3 ways in which you can effectively market for client acquisitions. The first one is, again, making sure that you have all the right material, whether it's in print, social media, websites, webinars, any of the things that you're going to want to do there. The second one is your own educational marketing, how we're going to help you make sure that you have the right information to be able to share this with other folks. The third one is network marketing, which again leads me up to this last one. And the one I want to kind of wrap up with is your why. Why are you doing this? Why would you want to get into medical billing in the first place? Well, you may say, hey, Eric, I want to get into it because I want to own my own business. But let's peel that back a little bit. And let me share with you what I think part of your why can be. Because there, as you can see here, I'm not just going to read this word for word, but you can see, I think you need to know what the deepest reasons why you want to do what you do. And part of this is I want you to start to build your own story, your own business story. Because once you can create your own business story, then it becomes so much more believable than you just saying, I want to get in because I want to make some money, or I want to get in because I want to own my own business, or I want to do whatever. It may be more along the lines is that you want to create a legacy. You want to do some other things because you can see what the condition of the healthcare industry is all about. That's the big why. And I'm going to share that with you real quickly. But again, kind of helping you develop that why is, again, one of the reasons why I want you, again, to get a PDF copy of the new Thriving Medical Practice. Because in that, you're going to start to develop your own why. Why would I want to do this? Why would I want to help other doctors get more money? I think what you're going to find out here is because I think our healthcare system is failing. Let's just put it bluntly. Our healthcare system is failing. The doctors know that the healthcare system is failing. They're struggling. They're frustrated. They're frustrated not only of not maybe sometimes losing their own patients, or they can't see enough patients, or they can't get the money. They hired the wrong staff. They've got issues at home, whatever it may be. They're frustrated. One of the things that I took on whenever I started doing my medical billing company, my why became, I want to help my community have a better healthcare system. And that has never gone away. I still go to Chamber of Commerce meetings. I still engage with the mayor. I still engage with all the folks that are within my community. And one of the things that they know of me all the time is, what can we do to improve our healthcare system within our own community? I found out that we're in a need of having more primary care physicians within the area, and I'm actually helping attract more and better physicians to come in the area for that. Even some specialties that come within my area. So you're going to find out that whenever you're taking one of your loved ones to the doctor, that's going to make a big change. And the reason I say that is because we did take our loved ones to the doctor. We wanted to make sure that my in-laws had the best healthcare systems in there. What I didn't want to take them to was to a doctor who was trying to rush us out of that room so that they could get another person in the room so that they could make sure that they get to pay all their bills. You see what I'm saying here? I want you to understand that that's what a lot of patients feel like. Gosh, I'm just a number here because the doctor doesn't want to see me any more than 5 to 10 minutes. So they got to rush them out. And the patients don't know why. The doctors know why. Because they know that whenever they get through that billing for that particular day, they may only get 70 to 80% of what they're actually going to be able to bill for that particular day. Why is that? Because someone's not doing the billing correctly, or they're using some antiquated software, or something's going on there. So your why, part of your why needs to know that you are helping improve community healthcare. That can be your why. And that's really, as you kind of step back away from all the things that we've been talking about here today, you're going to find out that the most satisfying thing that you're going to be able to bring to your community is whenever you do show up at a Chamber of Commerce and you took Dr. Smith or Dr. Brown or whoever that is, and you've helped them increase their revenue, and they're starting to talk about you. And they're telling the community at that point, gosh, because Eric came in or Frank came in or James came in, and I'm using some of the names here that are on the webinar today, because they came in, they helped me. I'm actually spending a little bit more time with my patients. They're actually getting better healthcare from me because I'm not having to worry about meeting payroll. So folks, take what I've shared with you today. Obviously, when you go through our training is going to take you almost 2.5 weeks to get through. I've only scratched the surface of the full marketing campaign and all the other parts of what we try to do here. So as we kind of start wrapping up here, I want you to rest assured that you can leverage ABS's 30 years of experience. We haven't just been around here for 30 years helping one or two people get new clients. We're around here because we've actually helped our ABS business owners gain thousands of clients over the years. I mean, we can go back to talk with some of our folks here who are still doing billing with the same clients that they had 10, 15, 20 years ago. So we know what we're doing in that aspect. So all we're doing is asking you to leverage all of the different aspects of the marketing campaign that we have ready for you to go. First of all, I want you to be able to, if you haven't been able to do this yet, go to our website and download our 5 Secrets to Success. Just put your contact information in there. We already have it already. We didn't, you wouldn't be on today's webinar. But I want you to go over there because what you can find there is all these different things that I've been able to share with you so far. You're going to see elements that actually in them. That first one right there, educate to build trust. But then you're going to also see some white papers from some of our current ABS business owners already, what they were able to do, what they were able to learn, and how they got their first client.